It depends upon the relationship. As the when an adult who's married develops epilepsy as a new diagnosis, that's a different discussion, because in that process, the relationship, though still loving and one of two partners, spouses, husband, wife, it does change in that one has now become a caregiver. So one would be cognizant of that the role that they might have as being a caregiver, and some of the importance of that, some of the burdens that might place upon them and the relationship and how that might change, and being aware of that. If I'm talking to a young adult who might be single, critically, success in epilepsy and disease management really involves a large network of people. Supporting a patient as they might travel through all the complexities of an epilepsy surgery evaluation, being present during a hospitalization to help identify seizures, being support in being compliant with medications, particularly for the adolescents, and also being a witness and a historian and a source of history-present illness, as unfortunately it's not uncommon for patients to be amnesic to their seizures. If it's a new relationship between a boyfriend and a girlfriend, I'll talk about, importantly, definitions. What is epilepsy? What are seizures? How are they correlated? What are some of the side effects of medications, and what are the goals of seizure treatment? Seizure freedom, normal vocational status, and some of the elements of harm. And we all talk about things such as SUDEP. So the conversation I might have with the partner, loved one, would really depend upon their role. And lastly, of course, the parent of a young child with epilepsy, and that's a whole different discussion, is they're a guardian and steward of someone who is the future an adult, and advocating for the child through the parent and helping us navigate a process where the epilepsy does not impact their future development. So they would have the highest probability of being autonomous and independent as an adult.